Here with me now is someone who's been studying coronavirus and the path it's taken in the United States since the beginning of the pandemic. Marc Lipsitch, he's a professor of epidemiology at Harvard's T.H. Chan School of Public Health. Marc, thank you for being with us. I think what we need to do is hear from more people like you on an ongoing basis to give us an evaluation of why we are where we are on July 3rd. We are seeing things in Houston, in Texas, in Arizona, and to some degree in Florida and California that reflects what we went through 2.5 to 3 months ago in the Northeast. Why are we here right now?
Well, thank you for having me. I think we're here because many parts of the country have decided that they're tired of restrictions and that they're reopening. And they're doing that in a way that reflects understandable fatigue. We all hate these restrictions. Nobody enjoys them. But that do not reflect the data and do not reflect a situation being under control. In fact, some of the states that have been fastest to reopen are the ones where it really never was under control and was still growing when the reopening began. If you contrast that with almost every country in Europe and almost every country in East Asia, and in fact, a few of the states, we have some examples of responsible behavior in some of the northeastern states here. These are states and countries that have brought the case numbers down to a much more manageable level before reopening. And it's pretty much as simple as that.
Let me ask you, Marc, not only is it frustrating and people are getting tired of being at home, but it's economically very, very difficult. So it's times like this when people like me who don't know anything about this have to rely on the expertise that we know exists in people like you, epidemiologists, virologists, public health experts. But the translation between people like you and people like me for these kinds of rules is government. And in these European nations you talk about and these Asian nations you talk about, and even in the states that have done this well in the United States, people trusted their governments to give them direction, and generally speaking, they followed that. What we have in the United States is a federal government that hasn't been on board with the idea that will give you the direction you need to make the difficult decisions.
That's right. I mean, there's been an incredible vacuum of leadership from the federal government. That's been true since January when this became an issue. And for 2 months, it was denial that this was a problem and it was going to go away in the spring like a miracle. Then that fell by the wayside, and New York and some other places began to visibly suffer, and we had some national efforts, but again, mostly led by state governors to slow things down. And it's very clear that the countries in Europe and in Asia that have had success, that have kept cases to a tiny fraction and deaths to a tiny fraction per capita of what we've had, have done so because they had resolve, they had very quick action, not all of them as quick as they should have been, but quick action, and then they held it in place. They held the restrictions in place, not until people got sick of it, but until the illness receded. And that's a very different behavior, and it's all about leadership.
Earlier today, I spoke with Peter Navarro, who's advising the president, and he started talking about how hydroxychloroquine, said there was a new test, a new study out that indicated that it lessens symptoms in people who have this. And he said we really need to start thinking about using therapeutics and, of course, ultimately waiting for a vaccine. That seems to be some messaging that's coming from the White House now. We need to live with this. Is that what experts like you would recommend, or are the basics like masking and social distancing, even if we go back to work, the way to prevent the spread of this virus?
Well, as we just saw in Houston, people are having to try to live with it, and more are living because of medical innovations. But this is not a good situation, and there are ways to stop it. There are ways that individuals can take with really reliably wearing masks, really reliably distancing, not going to bars. There should not be bars open in states that are really in any state in the United States right now. There should not be other crowded, unventilated places. This is just how the virus transmits. And we've seen example after example. It's a mixture of state leadership, because the federal government just isn't providing it, and then individual action to do what their states are telling them in the case of places like Massachusetts and New York, or what they're not bothering to tell them in a short-sighted effort to reopen prematurely in places like Texas and Los Angeles.
Mark, what do you see as the trajectory? The CDC says that we may have 160,000 deaths by the end of July. Is there some way to obviously slow this down right now? I assume there is, because I look at the charts, the 7-day rolling averages of new infections in other industrialized countries, and most of them have.
Yeah, there is example after example of how to slow it down. It's very hard to completely get rid of it, especially in a globalized world and in a country that has lots of land borders between jurisdictions that are doing different things. So it's going to be with us. We're not going to get rid of it, but we can bring the number of cases down. It's happened in Massachusetts. It's happened in New York. It's happened in countries all over the world. And it is very possible. It is painful. And what I think we have to remember is that that shutting down in crises is even more painful, because you, first of all, don't solve the problem, because you've already had, by the time you have a crisis, you're going to live with it for several more weeks while the control measures take effect. But also, it's much more disruptive to shut down in a crisis, and a much more slow first reimposition of control measures in places that are growing, and then very, very cautious reopening of the sort that's happened in other places is the only way forward. I think a lot of us would like to think about a September where our kids can go back to school and have real school for all sorts of reasons. A lot of us would like to see this pandemic stop taking the toll that it's taking on everyone, especially on disadvantaged people, especially on people of color. That's been underreported. It's universally true in this country. And we'd like to return to some kind of normalcy. And the way to do that is to get it under control now. And as some colleagues of mine wrote in the Washington Post a few days ago, if we want to see our kids back in school, we are going to have to give something up. And maybe bars and gyms are the sorts of things we give up to try to reduce our transmission now, reduce cases, so that by September we have a fighting chance of having a more normal life.
Mark, thank you for your expertise and for sharing it with my viewers. Marc Lipsitch is a professor of epidemiology at Harvard.